Here at the Royal Alexandra Hospital, the winter pressures have seen staff stretched like never before.
He's come in with chest pain today, but he's previously had an NSTEMI.
What's most difficult for me is that I have to keep asking my staff to give more and just a bit more and just a bit more when I know that they're exhausted and when we don't know when this is going to end.
We've got a few of them waiting, so I thought I'd come into that room, and then once we get this bay cleaned, that would bring that patient in. And then
the impact of COVID is being felt across the hospital. A changing situation every hour of every day.
We've got patients just now that are on trolleys down in accident and emergency that can't come into me because I've not got the space.
Certainly over the last 4 to 5 weeks we've had periods where we haven't got a bed for anybody, and we've had people waiting in ambulances while we can free up beds for people to come in.
There were a few days where we had people who were having their first assessment out in the back of the ambulance purely because there was no capacity, and particularly for people who we knew perhaps they'd had a positive test in the community. It was not an acceptable risk for us to bring them here and have them on trolleys in the corridor.
Patients arriving at the emergency department are immediately taken here if they show any COVID symptoms. This is a ward designed to offer a quick assessment, not a long stay. From here, patients should be transferred to other wards, but beds and adequate staff are an issue.
It's wards that have literally no staff, or they have one trained nurse to look after 30 patients, and that happens day in, day out at the moment.
So how are you managing to cope?
We are just frantically juggling, in all honesty. The staff are enormously flexible in terms of going to areas that they're not familiar with, but it's exhausting. It is exhausting for everyone. I understand that people are at home and they're worried about what's happening with their clinic appointment or what's happening with their surgery, but believe me, the staff here are just as worried about that, and we are desperately trying to find ways that we can juggle all these balls, but it's just so difficult.
In the last few weeks, new rapid testing has been introduced to identify positive cases quicker. Now, instead of waiting over 24 hours, the results are back within 45 minutes. Carrying out these tests is senior charge nurse Agnes Monaghan, who only returned to work on Monday after recovering from COVID herself.
What is the priority when people come through that door?
It's to get them assessed and get their COVID status as quick as possible so as we can release them in the best appropriate place. And there was more positives the other day than negative patients, so I think we're still maybe in the middle of it. I don't think we're quite over it yet.
A number of colleagues remain off sick or are self-isolating.
It's quite difficult because it's quite a close-knit, tight unit, and there's a couple of staff that aren't very well, so I think it's just quite a worry for the other staff that are here. I think they worry about their own personal safety as well.
Hopefully I'll go back home, hopefully not be here much longer.
52-year-old John McAllister, who has COPD, is waiting on the results of a chest x-ray.
Tested positive for COVID last Tuesday, and my symptoms have got worse as the weeks went on. My oxygen levels went down today, and my temperature and that was up. My niece as well, she's got it off of me as well, and she's got a bad asthma. So yeah, it's quite quick the way it's spreading as well.
And had you been taking care?
I come up to hospital for a chest x-ray on the Monday. I went to work and I went shopping one day to get a birthday card for my nephew, and that was only 3 places I was, and I tested positive. It's quite scary.
Once patients receive a negative COVID result in accident and emergency, they arrive here in the acute medical ward where medics remain vigilant for symptoms. Staffing levels here are a constant challenge.
Over this last month, I would say it's just got harder. You've got this pressure of trying to get, because you know there's someone lying on a trolley at front door and you want to get that person off a trolley into a comfy bed, but you need to get a bed downstream. So it's a bit of a vicious circle.
Do you feel overwhelmed?
Yes, definitely. Yep, there's no yeah, definitely. And if I feel for the junior nurses, because I have been here for years, And obviously we've got quite a few nurses in the hospital and doctors and HPs. People are obviously going off with COVID symptoms. Probably, I would say I'm seeing more now than I saw at the start.
Have you yourself had COVID?
Yeah, I had it right at the very start. For the nursing staff, I think we're all very weak, the ones that are coming back, because coming back to 3 12-hour shifts on the trot is hard going.
These patients tested negative for COVID on their admission. Staff do what they can to relieve any worries during the wait for test results or the transfer to a specialist ward.
Was transferred here today, and the staff are just...
Well, my son phones me all the time, and I have a son in Spain, and he phones, and my granddaughter's phoning, give me a wee tinkle. So if I want to get well, and that's the main thing. See, as soon as you get out that door, they've got a mask on you, and they do look after you. I get so angry when I see these people going about not wearing masks and not keeping the distance. They should just look at all these poor people that are in the hospital dying and say to themselves, for goodness sake, let's try and do something decent and get rid of this thing.
In what previously were elderly rehabilitation wards, dealing with COVID is now the priority. Patients like Irene Cairns are likely to be in the care of staff for many weeks.
I had to get me oxygen, suffering and oxygen for what, 3 weeks.
The 78-year-old still needs help to breathe and knows her son at home is extremely concerned.
David wanted to come and visit me. I said, no, we're not taking that kind of chance. They want to believe it's never going to hit them. But be realistic and start caring about other people a little bit.
Many do recover. Jim has his bags packed and is ready to head home.
I'm feeling grand. Believe you me, after the necessary time spent here to get better, I am ready for the out.
The 80-year-old tested positive after socialising with his neighbours at New Year. All 3 developed COVID symptoms. Only Jim ended up in hospital.
The one day I went out in the 2 weeks of self-isolation, and I went in for my neighbour with a slight drink and a biscuit, a cake, and bang. 2 days later I had received a SMS saying, your neighbours have tested positive. And believe you me, I wish I didn't.
When you got that text to say that had happened, how were you feeling?
Oh, it flattened me, because at that point I was good. I didn't know. Relatively didn't know. But it came in quickly after that. In here has been a godsend, really. You know, you don't realise how good these places are till you've come through them and you've said to yourself, I've just been in a place where people have died. That's scary.
What's been your toughest shift so far?
I would probably say my first death. I can still remember it as clear as day. About back in April. Yeah. For me, that's probably what it's been. Yep.
Stays with you, does it?
It does.
On the wards, dealing with death is a tough reality.
I'm struggling with it because we're seeing a lot more death and dying. I am used to maybe having 1 death a month, and now we're seeing several deaths in a week. I've become a bit desensitised to it, but you'll never get used to the death and the dying and the loneliness of patients because they're not seeing their relatives.
Every day I have to speak to at least one family and invite them up to the ward to discuss end of life, and we are seeing it more and more. It does affect you as well.
And can your training really prepare you for that conversation every day?
I graduated 7 years ago now, and I've never had to do or deal with end-of-life care to the volume that I'm dealing with in the last month to 6 weeks. I don't think you ever get used to having those conversations with people, and they're always very challenging.
I think for us, I think we all feel that this wave has been harder. I think some of that is that patients do seem to be sicker this time round, and work just feels incredibly hard. And if we're honest, we don't fully see an end in sight yet, and I think we're all feeling very tired and worn out by it.